Okay, it's just shortly after 11 o'clock. I think we're going to start this morning. Welcome, everybody. My name is Gail Miksic. I'm with ElderWorks Educational Services. Welcome to our Medicare 101 seminar. And I just would like to remind everyone that this presentation is being recorded. For those of you who are not familiar with ElderWorks, we are a 501(c) corporation, and we provide assistance to older adults, seniors, and families who need guidance for senior living, home care, and support services to help make appropriate decisions. This includes education on senior topics such as today. The guidance we provide will help seniors stay home well or transition successfully into a new housing opportunity. If you have questions throughout this presentation, we would like you to hold those questions to the end, and our presenter is happy to address all those questions. Please use the Q&A button on your screen to ask questions, or feel free to use the chat box. After the webinar, a short survey will pop up, and we would really appreciate your feedback. So without further ado, I'd like to introduce Frank, and he is going to start our presentation this morning. Welcome, Frank, and if you can please share your screen.
Thank you. All right, so share screen. Here we go. Okay, can everyone see that?
No.
Can't see that. I'm sharing my screen. Hold on one moment, please. How about now?
We're just about to see it. I see it.
Okay.
Oh, there you go.
So you can see this now?
Yes, we can.
Okay. So good morning, everyone. Thanks for joining us this Monday morning. I really want to start out by thanking Gail and Emily from ElderWorks for putting this together for all of you and giving me the opportunity to share some knowledge about Medicare. I know it's very complicated. People get a lot of mailings and things this time of year. There's a lot of commercials on television and the radio. And so there's a lot of information that flows constantly, into your household every day. My job as an insurance advisor to seniors and people on Medicare is to just make it a lot easier for you and help you understand what you need to know about Medicare and how it works. Okay, so just a little bit about me. Here's my background. I'm 7 years in the business. I've always been self-employed. I had a career down at the Chicago Board of Trade for many years, and then I started this business 7 years ago. I'm appointed with the following insurance carriers: Aetna, Blue Cross Blue Shield, Humana, and United Healthcare. So those are all nationally known companies. United Healthcare is the largest insurance company in the world, and they actually own HealthMarkets. They purchased us last year. So we're a subsidiary of them. As a broker, however, I do have access to all these products that are available across the market. I've been pretty active in regards to marketing, and I'm currently president of a marketing organization called AmSpirit. I'm also a member of the Niles Chamber of Commerce, and that's how I know Gail. And I'm also a member and former Grand Knight of the Knights of Columbus. And since I was 20 years old, I've been a member of the Tau Kappa Epsilon fraternity. So what we're going to cover today are some key terms that you're going to hear quite often when people discuss Medicare. The beneficiary is actually the individual who's covered under Medicare. A premium is a fixed amount that you're going to pay for the coverage. It's a monthly premium. Okay. A deductible is a preset fixed amount that you're going to actually pay before the insurance starts to cooperate and pay their share. Co-payments or co-pays are preset fixed amounts that you're going to pay for each service or product, like a doctor visit or medication. Oops, sorry, let me go back. And the co-insurance amount that you're usually, the co-insurance is like a percentage. that you have to pay for a shared service after you pay the deductible. So deductibles first, co-insurance is next. So I'm going to give some examples. This is Joan. She's 64 years old. She's planning to join Medicare at age 65. She doesn't know much about Medicare, but she does know a few things, like it's a federal health insurance program. It began in 1965 as the result of the Medicare Act, and it provides health insurance for certain people, folks who are 65 and older, people who are under 65 with certain disabilities, and those with end-stage renal disease. Oh, and she gets a card, which is that card right there. So some of you folks on this presentation might already have this. Others who are just learning about it will also receive one in the mail. They assign you a special Medicare number and effective dates, okay? It's not your Social Security number anymore like it used to be. It's just a random number generated by the government. So Joan did some research, learns Medicare is not a single government insurance program, and it actually has 4 parts. So Part A is covering hospitals, skilled nursing, home health care, and hospice services. And then there's a Part B. This is going to cover your doctor's office visits, your preventative care, any diagnostics, or durable medical equipment. That's DME, durable medical equipment. Part C is what's called the Medicare Advantage plan. Now, you're going to see these on television and on the radio and get mailings about this quite often throughout the season, or up to 3 months before you actually age into Medicare. And the Part D is the prescription drugs, and that's going to cover any medications that you might be prescribed. Part A and B are going to be known as your original Medicare. So everyone's going to have that once they get that card. And we want to talk about those parts and the eligibility, who qualifies for it. So based on her work history, Joan worked 40 quarters or 10 years. So she's paid into these Medicare system, okay? She may qualify under a spouse's benefits, or, this is pretty rare, you buy it if not qualified because you haven't worked enough hours or quarters, and it could be up to $458 per month. Again, that's pretty rare. There are out-of-pocket hospitalization deductibles. $1,408 per benefit period covers days 1 through 60. Days 61 through 90 are $352 per day co-insurance. Days 91 plus are $704 per each lifetime reserve day after 90 per day benefits. There's out-of-pocket fees for skilled nursing facilities, up to 100 days of coverage. Days 1 through 20, you typically pay 0. On days 21 through 100, you'll be charged $176, okay? So this is Medicare Part A. Now Part B is going to be covers the hospitalizations, okay? So people are going to be charged every month for Part B, typically based on income. So most people fall into the $144.60 per month premium. The more you make, they look back actually almost 2 years, the more you would pay. But like I said, most folks are going to make under the $144.60 payment every month. It's going to cover medically necessary services, and it also covers the preventative services, okay? So she has to pay that premium for Part B to cover any of those other services. So what other out-of-pocket costs might she face? Well, there's this annual deductible of $198. Medicare will cover up to 80% of the cost. The beneficiary pays 20%. And there's a 15% excess charge if provider doesn't accept Medicare assigned rates. And then you'll see where it does not apply in those states below. We're specifically probably targeting Illinois today. So she's concerned. Why? Because she understands now that Medicare doesn't cover 100% of her out-of-pocket costs. So what doesn't it cover? Acupuncture. This will not be a covered service under Medicare. Chiropractic services. Nursing homes. Any dental care or dentures. any hearing services, hearing aids, any routine visions or glasses, emergency medical care that you may receive outside of the United States, and prescription drugs will not be covered under Parts A and B. So she recalls prescription drugs are covered under Part D. So how does she get Part D, and what kind of expenses could she face? Well, she finds these prescription drug plans. Okay, they're called PDP, okay, prescription drug plan, and they're offered by private insurance companies. To qualify for a drug plan, you have to be enrolled in Part A and B. So you have to be paying the premiums for B. And if you don't enroll when you turn 65 years old, or if you become Medicare eligible, for every month you're not on those drug plans, you will have a penalty. They're minor penalties. They're not very expensive, but they will start to incur from the day you're eligible. She also learns that she can purchase standalone drug plans, or they might be included in what's called a Medicare Advantage plan. Deductibles usually apply. That's the part that you're going to pay first before Medicare pays. There's typically a drug list or what's called a formulary, and it's based on the different tiers of those drugs. And then premiums can range from $15 per month up to $100 per month for a drug plan, a PDP. So it turns out that all Plan D plans have pretty much the same structure. It doesn't matter what company you go with. There's going to be a deductible typically. There's an initial coverage period. So that means there's co-pays. And then there's what's called the coverage gap or the donut hole. We'll get into that more. And then there's catastrophic stage. So these 4 stages are covered typically, okay? So she knows about deductibles, but what do the other stages mean? How do they work? So let's start with your deductible phase. Basically, a deductible means you're going to pay 100% of the retail cost of the medication. There's no copay for that drug. Now, there is going to be copays under a Part D coverage plan, and the threshold is $4,130. So, in essence, as you're paying towards your medications, $4,130 bucket gets filled. Part Plan D will pay the balance, and then this is called the coverage gap threshold. So now you're kind of going into what's called the donut hole. Brand name drugs, typically we get a 70% manufacturer's discount. Member has to pay 25%, plan pays 5%. This is when the drugs could get expensive. And then here's the generic drug copays as well. And once you exit what's called the donut hole, you're entering what's called catastrophic coverage, and then your payments drop dramatically down to only 5% is the most you may owe on that drug. 15% the plan pays, 80% Medicare pays. So that's a total of 100%. This comes into play when people are taking very expensive medications, or if they take a lot of medications. For an example, my mother's 81 years old. She takes a lot of medications that are expensive. She typically reaches the donut hole by March. So everyone has their own different case. So she's concerned. She's concerned about what out-of-pocket costs will be incurred where Medicare is not actually covering her. An extended stay in a hospital, a serious illness could affect her retirement plan. She's going to be dipping into her money that she's been saving, even with Medicare coverage. And then, she has to consider a lot of things. What is a premium going to cost? What is this co-insurance going to cost me? How about my co-pays, my deductibles, donut holes, and non-covered expenses? These are all things that are concerning to folks who are on Medicare. So does she have an option? She sure does. So she calls her friend, Diane, who enrolled in a Medicare plan last year. Now, Diane purchased what's called a Medicare Supplement plan. And she tells Joan about it. And it's called a GAP plan as well. So Medigap plans, MedSup plans, you guys have heard about these probably. It's sold by private insurance companies, and it works with the original Medicare's Part A and Part B. What it basically does is it covers the parts that Medicare doesn't cover. They actually fill the gap. And what it doesn't cover, however, is the medications. It doesn't cover drug plans. And you can't buy a drug plan if you buy a Medicare Part C plan or a Medicare Advantage plan. It's a standalone plan typically, okay? She wants to know if all Medicare supplements are the same. Pretty much they are, except prices. So based on, the different letters here, so the very, very popular Medicare supplement plans that people will be buying are the G plan, which is the most benefit-rich plan, and the N plan, which has a minor deductible. They used to have Plan Fs, but Plan Fs have now gone away, and the best plan, a Medigap plan, would be as a G plan. And each individual company will have their own prices for these Medicare supplement plans or Medicare gap plans. So now she understands there is some protection. And she, her friend, Diane, recommends that she talks to her friend Phil, who has a different type of Medicare coverage, and it's called the Part C Medicare Advantage plans. So she calls up Phil. Phil explains that he has a Medicare Advantage plan and it's offered through a private insurance company. These are also known as Part C. So Part Cs are pretty unique, where they cover Parts A and B. They also include drug plans. So it's known as an MAPD, or Medicare Advantage with Part D. And they have many other comprehensive benefits that are not included on a Medicare supplement plan, like vision, hearing aids, dental, podiatry services, chiropractic services. Very, very comprehensive. So when Joan reaches the MA plan, she learns how to qualify. You have to be enrolled in Part A and Part B, and you have to live in the plan service area. And it goes off of your zip code. And you cannot have end-stage renal disease to purchase one of those. So Medicare Advantage has two different networks, HMO, or a health maintenance organization, versus a PPO, preferred provider organization. So you've heard of these terms in the insurance market for many, many years, the HMO versus PPO. And their Medicare Advantage plans come in both of these, okay? So you have to have your plan B in place. You have to be paying that $144 a month. Some of the Medicare Advantage plans, believe it or not, are zero premiums or very low premiums. So they don't cost anything. They have co-pays and co-insurances for services, so you pay some small fees for doctor services, etc. And they all have what's called the maximum out-of-pocket, or the MOOP. So you will be stopped out as a maximum amount of money that you would have to pay per calendar year on these plans. The HMOs have non-emergency care from network providers. The care is coordinated through your primary care physician, so it's a referral system. And the referrals have to be authorized between the primary care physician, any specialists, or any facilities. The PPO has in-network and out-of-network providers, a little more flexible. There's no primary care physician assigned to you, even though you'll have one. It doesn't have to be the primary care person that's going to be the navigator, the gatekeeper, the quarterback, whatever you want to call them, to actually recommend where you're going to go and then approve those services. You also have the freedom of choice, so there's no referrals required. So these are the considerations. Medicare supplement plans pay Part B premium. Med subs have higher premiums and little or no out-of-pocket cost when used. You typically have a small deductible, $180 to $200, and then they'll pay everything. Medicare Advantage plans have to pay Part B premiums. They'll have low or zero premium charges every month, and then there's co-pays and co-insurances as the plan is used. Provider choices, any provider accepting Medicare will take a Medicare supplement plan, period. Medicare Advantage plans have provider networks, so you have to stay in that HMO or PPO network. However, you do have flexibility. Like I said, on the PPO, costs are typically higher out of network, just like on regular insurance. If you go out of network on regular insurance, you're typically not covered. So what's the best fit? Medicare supplement plans, and again, this is all flexible based on people's personal preferences, okay? People who are frequent travelers may prefer Med Supp plan. It might be important to use any doctor, so they might not want to be confined to a typical network. You can use many health services and you can afford the premiums. A premium for a Med Supp is $120 up to about $180 per month, in addition to your Part B. Medicare Advantage plans, you pay your Part B premium. Again, they have lower zero premium costs. Copay and coinsurances are used as the plan is used. That goes into your out-of-pocket bucket. There are provider networks. The costs are a little bit higher out of network, typically used by infrequent travelers, people who are a little more comfortable with narrower provider choices. You don't see the doctors a lot, and you want to save on premiums. You can't go lower than zero. And then there is drug coverage on MAPDs, but they're not offered through the Medicare supplement plans. You have to purchase the Part D drug plan to get your prescriptions covered. And even if you're not taking medications when you enroll in Medicare, I highly advise that you purchase one, because God forbid something happens and it's not an annual enrollment period and you need to get access to drugs, and they could be expensive medications. I'm talking about cancer drugs. You could be in big trouble because you don't have drug coverage. So choice one, original Medicare Part A and B, the Medicare supplement coverage wanted, and then you add a drug plan. So that's basically going to cover all of your out-of-pocket expenses that you may incur. Or choice two is to enroll in a Medicare Advantage plan. It's a Part C plan, and Part C plans are going to have drug coverages under the Medicare Advantage plan, and they also are very, very comprehensive in regards to additional services that you don't have with the Medicare supplement plan. Again, dental, vision, hearing, chiropractic, podiatry services. Some have gym memberships. So, at an educational event, she finds out there are programs to help with Medicare expenses. Some people may be eligible for Medicaid. Medicaid is different. This is based on income. It may help cover costs not covered by Medicare. It may provide some benefits not covered by original Medicare. These are people who are on lower incomes. Some folks are eligible for what's called a Medicare Savings Program. Again, based on income, you may get help paying for Part A and B costs, and you may get help for covering premiums, cost sharing, deductibles, copays, and coinsurances. And then the last type of help that someone might get is extra help called an LIS, or a low income subsidy. Those help cover your Part D prescription costs and premiums, deductibles, coinsurance, copays, coverage gap. So once in a while, I do run into a Medicare eligible person who has an additional benefit through the government on one of these programs. So how does Joan get started? How are you eligible for Medicare? Well, there's a list here on the left that you'll see that you have to qualify through this. Number one, you have to turn 65 or about to. The good news is 3 months before your actual birthday month, you can enroll in Medicare. So if your birthday is in April, you can start enrolling through Social Security to get those benefits in place on April 1st. Medicare will always start the first day of your actual birthday month, not on your birthday. There's an annual enrollment period. How exciting. It starts this Thursday, October 15th through December 7th. If you want to make any changes to what you currently have, or you want to look at your options, someone like myself will be more than happy to make an appointment with you and discuss what you currently have and what's available in the market. And we design a plan based on your budget through this period, October 15th through December 7th. Outside of the AEP or annual enrollment period, you have to have a qualifying event. Okay, so something like that. There's a list of those that we can discuss if we see if people want to qualify. So, like for instance, let's say you've moved outside of your planned service area. Let's say you live in Illinois and you want to retire somewhere warm like Florida or Arizona. Now, obviously, you know, doctors will change, hospitals will change. This is what's qualified as an AEP. A special enrollment period. So you actually have a qualified special enrollment period out of AEP where you can discuss with an agent the plans, hospitals, doctors, and stuff that are covered in that area. If you're overseas and you move back to the United States, that's also a special enrollment period. If you've moved into or out of a long-term care facility, again, you're going to have a period of time where you can discuss options that are going to be available to you. If you have traditional Medicare, but you want a supplement, you can purchase a supplement anytime throughout the year, but you cannot buy the drug plans outside of AEP. If you were released from jail, you're eligible for Medicare, you now have a special enrollment period. Or some people plan on working past the age of 65. I've had clients that work to age 75 or longer. Once you leave your employer coverage, you now have an additional enrollment period where you qualify. There are some really nice resources online that you can look up different Medicare plans. You can create your own account. The Medicare.gov website is very popular if you want to do a little research. The one on the right is the Social Security website. So when you're actually eligible for Medicare, you can enroll for Medicare Part A and B through the Social Security website, or you can call them. Many of my clients call. It's a lot quicker. The process moves much faster. And obviously the brick and mortar locations are closed right now. So you don't even consider going to a Social Security office. You can use these resources. You know, a lot of the information on these different websites is confusing in the mailers too. So it's in your best interest to contact somebody like myself, who is an insurance broker, which means I'm not captive to any other companies, you know, like a specific company. I have contracts with many. And I can do all the research for you, save you a lot of time, and I'll also take the time to listen to you. I'll sit down and talk about who your doctors are, what your medications are. I have a proprietary software program that I put all of that information in, and we have what's called the FIT score that gives us a top rating of 100%. If I have 100% recommendation on a plan, I'm going to give that to you first, and it's all based on your input, your wants and your needs, things like that. The phone number for my cell is 224-628-2951. I'm going to have a secretary working for me this annual enrollment period, but anybody on this call, feel free to call me direct. My secretary is going to be handling a lot of the other information, leads and stuff that I'm going to be purchasing. I have a email address is fliskovec@healthmarkets.com, or I do have a homepage where you can learn a lot more about me and some of the services I provide at the www.frankliskovec.com website. So at this time, I'd like to open up the call to anybody that might have a question.
Frank, Maureen is asking, if I have a prescription coverage through my work health plan, do I still need to enroll and be penalized?
Okay, so good question. No, you will not have to enroll. If you have a drug plan through work, that's considered credible coverage. and you will not incur a penalty. There's no penalty as long as you have credible coverage through an employer. Once you leave the job, then it's time to look at a Part D drug plan. That's a special enrollment period, or you can look at the Medicare Advantage plans.
Okay, do we have any other questions? Looking here.
Okay.
Anyone else would like to ask Frank a question? Oh, explain script coverage and donut hole again, if you can please
Okay.
go over that.
Sure. So the donut hole is the portion where you actually have paid X amount of dollars in medical or prescription drug costs. So let me go back to that slide, if possible. Hold on one moment, folks. Let's see if I can get there. Let's go back to that slide and be a little more specific. Because the donut hole changes every year too. I just want to see where the max amount of pockets are. Here we go. Can you guys see that? Initial coverage.
Yes.
Yeah. Let me see if I can. Am I still sharing screen? Yeah. Okay. Let me pop through here real quick. All right. So you're going to pay the initial coverage of up to $4,020 out-of-pocket drug costs. And that doesn't cover, that's not your copay. That's the actual, say the medication's $100 for the month. Your copay for that medication is $20. They're not using the $20 copay, they're using the $100 cost of the med. And as you continue to take medications throughout the year, once your prescription drug costs reach $4,020 this year, coming into 2020 and 21, you'll enter what's called the donut hole. Now there's no copay for your drugs. You're going to have to pay 100% of the retail costs of those medications. So it's going to get expensive, but you'll only have to do that for $2,330 because $6,030.50 minus $40.20 would equal that number. And then after you've breached $6,350 in drug costs, then it drops dramatically down to 5% copay for you, no matter how much the drug costs, and that's the catastrophic coverage. And the donut hole thresholds typically change every year. At this point, we're at $4,020. Again, it's not the copay that you're going to be filling up the bucket with. It's the actual cost of the drug. So let's just say, unfortunately, someone gets cancer and the drug is $5,000 for the month. They're immediately going to reach the donut hole immediately because it's going to be $5,000 goes right in there. And most likely that person reaches catastrophic coverage pretty quickly. That makes sense. Anything else? I would just emphasize a couple more things. It did say basically that Medicare supplement plans are good for people who travel a lot. That was pretty true in the past. Now these Medicare Advantage plans do cover emergency services in the United States and overseas. And starting next year, I actually have a Medicare Advantage plan with United Healthcare that will cover emergency services and necessary medical services overseas as well. So they're very flexible. And they also have built into them the dental, the vision, podiatry services, chiropractic services, gym memberships for free. silver sneakers. The drug plans are included. Many of the carriers offer credits at pharmacy. So you can go to a pharmacy and have actual $30, $40, $50 per quarter to spend on over-the-counter goods at that provider, that drugstore, for free. A lot of people want to know, well, how could it cost zero? So the Centers for Medicare Services, or CMS, give money to these private insurance companies based on how many members they have enrolled. So that's why there's a big marketing, land grab during the annual enrollment period, because the more members that these companies get, the more benefits that they can add to the Medicare Advantage plans, and they literally spend down the premium to zero. So all of the carriers that I contracted with have a zero premium plan offered to consumers. And again, very, very comprehensive compared to a Medicare supplement, which covers just the medical part, and then you still have to buy the drug plan. So you're looking at $150 to $200 a month just for that, in addition to your Part B.
Okay, Kathy, I don't think you answered this. The POP plan now, I want to keep it as a supplement when she starts Medicare next year. Will supplement premiums decrease? I'm not following that. Could you explain that, Frank?
What is the question? Is it in the chat?
It's in the chat.
I don't see it.
You should be able to see it. I have a POP.
I only see two.
Okay. It says I have a POP plan now and want to keep it as a supplement when I start Medicare next year. Will supplement premiums decrease, is Kathy's question.
I'm not sure. I'm not sure what that plan is that she has.
Okay.
I'd be happy to review it with her to see who offers the plan, what it costs, and do some research. Look, I've been doing this for 7 years, and my wife's been doing it for 30 years. I have a large amount of resources available to me. If I don't know the answer, I will find somebody that does, and I'll get that information to you.
Okay. Shelley is asking, up to $4,020 copay plus, what insurance pays then to $6,550, same thing, copays, and what insurance pays from $4,020 to $6,550? Are there supplement accepted all over the U.S.? Do brand and generics come into play with Part D donut hole?
Okay, so you're going to pay full price after you breach that 4,000 number. There is no copay for the medication, and then once those medications, the threshold gets to, I'll go back to the slide. Let's get back in there. Where is that Part D? You have to pay the full price basically for the drugs. You have to pay full price from $4,130 to $6,050. That's the gap. You have to pay full price. So if the drug is $250 and you're in the donut hole, you pay $250. There's not going to be a copay covered by an insurance company or your drug plan. So it gets expensive. But they had to draw a line somewhere. And then once you get into this gap coverage over the threshold of $6,550, then you reach catastrophic coverage.
Okay, and then it just says, let's see here. Just trying to. Oh, it says I was told that it's difficult to switch medical supplement plans. Got it on one price, brand and genetics. Okay. Where does pre-existing fit in?
It doesn't. Yeah, it doesn't. So if, let's just say you're on a supplement plan, okay, a Medicare Gap plan or a Medicare supplement plan, and you want to change that supplement plan, most insurance companies will put you through underwriting, okay, and you may be declined. The only one who doesn't do underwriting is Blue Cross Blue Shield. They will not underwrite that product. All the Medicare Advantage plans have no underwriting at all. And you can purchase those through your initial enrollment period, through the annual enrollment period, or through a special enrollment period. There's no underwriting there at all.
Okay. you know what, I'm trying to follow the questions that Shelley has. Let me just go here for 1 second here. I think I'm going to unmute you. It'll be easier to ask the question. Allow to talk. There you go. You want to ask that question? Can you? I unmuted you.
Sure.
Okay.
I actually had a couple.
Okay.
I'm a little confused. I was told that it's very difficult to switch supplement insurance plans because they may take you, but they may charge you a fortune, or they may not even take you because of pre-existing. And the pre-existing period where it's guaranteed issue is only for the 7 months around our birthday.
That's correct. The
So
only one who doesn't do underwriting, the only one who will accept everyone is Blue Cross Blue Shield.
what does underwriting mean? I'm sorry.
They're going to
It's
manage,
getting
they're going
price?
to, no, underwriting is they're going to look at your medical history and see if they want to accept you as a member. If you're too high of a risk, they may decline you.
And who does or doesn't?
Blue Cross Blue Shield does not. There's no underwriting.
And they won't charge you more for it?
It's based on your age. Are
When
you
you take it out?
under 65 or over 65?
I'm going to be 65 in January, so I have to enroll in Medicare, and I have to decide if I want a supplement or an advantage program before I enroll, right?
No. Have you enrolled in Medicare Part B yet?
No, I have to enroll, but I thought that when I enroll, I
No.
have to know if I want a supplement or if I want an advantage plan. I don't need to know that when I enroll?
No, Shelley, all you have to do is enroll in Part A and Part B. Okay, so get that Part B in force, call Social Security number.
Okay.
Based on, if you jotted it down. So
Yeah, I
call
did.
them, get Part B in place, let them know that you're turning 65 in January.
Okay.
Once you get your Medicare card, the red, white, and blue one I showed you,
Uh-huh.
for Part A and B, call me, then we'll go over your options. You don't have to, Social Security has nothing to do with these Medicare supplement plans or Medicare Advantage plans. That's going to be handled through an insurance advisor like myself. So once you get the Medicare card, call me, we'll set up the appointment, we'll go over your options.
And how long does it take to get the card, and how long does it take to get on the supplement plans?
Okay, so you have to, look, with COVID-19, everything is slowed down. So I'm not able to give you a definitive answer on that. All I know is they're processing people trying to enroll in Medicare as quickly as possible. You know, today's October 12th, so you're, over 2.5 months away. I would call as soon as possible to get the process started. And once you get that Medicare card in place, then that's when you can we can look at advantage plans and supplement plans and drug plans together and see what's the best fit for you. The one thing I didn't mention, folks, and it's very important, is I don't charge any fees for my services. So I will never charge you an office visit premium, nothing. You have to pay no fees for my services. And it doesn't cost you any more to use me when you're buying these plans. We don't tack on any fees or anything. I make a commission from the insurance companies, and they value our services. They want us to educate the consumer, to get enrollments into their companies, but it's not going to cost you anything to use me. Did I answer your question, Shelley?
Yes, thank you.
You're welcome.
I think that's all the questions we have. Let me just double check here. I think that's all the questions. Yep, that's all we have. Let me just double check real here. Well, thank you everyone for joining us this morning.